Let's talk about Botox. That's one of the most common injectables we do at Well Medical Arts. It's a neuromodulator, which just means it temporarily relaxes the muscles that we put it into. A lot of people come in and they say, where do I start? We do a full facial assessment so we can let you know the best areas to inject on your face. Some of the common areas include those frown lines that form those 11 lines, the forehead or the frontalis muscle to relax those lines, the crow's feet around the smile lines, as well as areas on the lower face and neck. The treatment itself is really simple. We do it in the office. The treatment's usually just a few minutes. Small, tiny needles, relatively pain-free. A lot of patients say, oh, did you already do it? So it's not that bad. It usually starts to kick in within about 3 days, sometimes up to a week. You'll see the results of those muscles relaxing. And treatment's recommended about every 3 months. Some people can go just a little longer, some people a little less, but in general, about 3 months. Give us a call and come on in. We'll love to talk to you more about Botox.